I'm going to start making a couple comments about whose talk. Certainly very interesting from a payer perspective and trying to impact physician practice and what we can do to get people under better control. I mean, as a couple comments that come to mind, I mean, when we're trying to discern between a physician that's a high performer versus a low performer, I mean, certainly as one who's been out, dealing with multiple physician groups, or now even with as ACOs are coming together, they within the groups themselves, they all seem to suffer from the Lake Wobegon effect, in that 85% of their physicians are above average. So it makes it a little bit difficult to separate that out. But in any case, a couple things to point out that I certainly found very interesting. I mean, the low performers, had the highest rates of metformin, sulfonylurea, insulin use at that point. If you think about it, though, looking at the time frame from when the data were taken, I mean, certainly, algorithmically speaking, if you will, those are, especially the metformin, as we discussed, and the sulfonylureas were very much recommended. And even as we start moving now toward a lot more use of electronic medical records, especially being pushed kind of in the 2011 time frame, which was the last year that you looked at. I mean, within clinical decision support tools, those are the types of recommendations that are out there. And so unless physicians are consciously aware of some of the changes that are out there or how to start, I mean, that isn't a surprise that we see a lot of really kind of beginning and pushing on those points. The other aspect to bring is that as we see, the clinical decision support changing going forward with more docs, meeting meaningful use criteria, I think that we may hopefully get toward better outcomes in the longer run on that. Another comment is that you made which I agree with totally. Looking at one data set, you kind of see the patients from that one group, and there's obviously a wide variety of folks that are out there, and the ability to kind of get, especially from the big buzzword now is big data, getting huge databases to be able to do the analytics on that is quite important. Up in Wisconsin, where I'm from, there's a group that's actually been functioning now for about a good 5-6 years called the Wisconsin Health Information Organization. And what we've done up there is we have not only the large payers, so Humana, Anthem, United, but a lot of the large regional players, in this particular case, the Wisconsin Education Association Trust, the Department of Employee Trust Funds, and it's really kind of putting all the data together so that as kind of our payback for contributing the claims data to that is that we're able to analyze it from a wider perspective and get a more broader view of a particular physician's practice pattern. So that certainly is helpful, and I would agree wholeheartedly that effort certainly will help. Another point to certainly mention is that it really becomes interesting in terms of the where, and I wasn't sure, I don't know, kind of bring this out as a question, but in terms of a specialty perspective, I mean, we know especially in type 2 diabetes, a lot of that care, and this is not a knock on PCPs at all, but a lot of that care is coming from PCPs because we just simply don't have enough endocrinologists available to see everybody with diabetes. And does that play a role on that? And especially perhaps changing clinical decision support going forward, that might be something that helps. And then the last point I really want to make at this point is that we know that patient behavior is it's about relationships. I mean, patient behavior is affected by the relationship with his or her physician. And we see that now, especially in ratings of physicians. A lot of plans such as ours, I mean, we have certain agreements with groups, whether it's vitals.com or analyzing kind of some of the claims data we have toward looking at the type of care and outcomes that certain physicians have and allowing that transparency. And that certainly then allows patients to gravitate towards certain physicians. Bringing everybody up would certainly help in that respect, but it's going to be kind of a little bit, I think, of a sine wave with respect to physicians being higher or lower performing. A lot of it depending on how the patient, addresses their treatment and what type of treatment is given there. So, really, that's kind of at this point, that's probably what I would want to say.